The rise of the AI doctor AI in healthcare. An in-depth overview of 2025 trends and beyond. 1. What is AI in medicine? Artificial intelligence, AI, in medicine refers to the use of machine learning, natural language processing, computer vision, and data analytics to simulate human cognition in analyzing, interpreting, and understanding complex medical data. AI doesn't replace doctors, rather, it augments their capabilities to make healthcare smarter, faster, and more precise. 2. Diagnostic AI, smarter, faster diagnoses. One of the biggest impacts of AI in healthcare is its role in diagnostics. Radiology, AI systems like ADOC and Viz.ai interpret CT scans, MRIs, and X-rays with incredible speed and accuracy, detecting conditions like pulmonary embolism, stroke, or hemorrhage in seconds. Pathology, deep learning models can analyze tissue samples to detect cancerous patterns better than human eyes. Ophthalmology. AI models diagnose diabetic retinopathy and glaucoma using simple retinal scans. Dermatology, apps like SkinVision or Google Health's AI tool can flag skin lesions as potentially cancerous. Brain Key Stat, studies show AI can match or exceed the performance of radiologists in specific use cases, particularly in early cancer detection. 3. AI in clinical workflow and administration. Doctors spend 30 to 50% of their time on documentation. AI is transforming how physicians manage notes, billing, and summaries. AI medical scribes, tools like Heidi Health and Nabla Copilot automatically transcribe consultations, summarize visits, and enter data into electronic health records, EHRs. Ambient listening, some AI tools passively listen to doctor-patient conversations, with consent, and generate real-time summaries. Scheduling and triage, AI bots handle appointment booking, symptom checking, and patient onboarding. Impact, saves physicians 1 to 2 hours per day and reduces burnout. 4. AI in medical education and training. AI is revolutionizing how doctors learn and prepare. Simulated training, AI-powered VR environments and virtual patients help medical students practice real-life scenarios. GPT-based learning, tools like Open Evidence, UpToDate, and ChatGPT 4.5 help students prepare for exams, review case studies, and clarify doubts instantly. Curriculum evolution, top universities, e.g., Stanford, Duke, MIT, are incorporating AI and data science into their core medical curriculum. Insight, future doctors will need to be fluent in AI interpretation alongside anatomy and physiology. 5. AI in remote patient monitoring, RPM. AI allows healthcare systems to monitor patients outside hospitals, a game-changer in chronic disease care and elder care. Wearables, devices like Fitbit, Apple Watch, and Bioformus track vitals and alert physicians via AI dashboards. Hospital at-home programs, AI monitors vitals, detects deterioration, and alerts caregivers in real time. Elderly fall detection, AI models detect abnormal movement patterns, reducing. 6. Robotics and surgery, the AI scalpel. Robotic-assisted surgery, RAS, uses AI to enhance precision, reduce recovery time, and minimize complications. Da Vinci Surgical System, already used in over 6 million surgeries, it's gaining AI-assisted decision-making capabilities. Future scope, the UK NHS plans to conduct 12.5% of all surgeries using robotic systems by 2035. Orthopedic and neurosurgery, robots help with millimeter precision in joint replacements and brain surgery. Mechanical arm edge, AI-assisted robotic arms can avoid tissue damage better than human hands. 7. AI drug discovery and genomics. Discovering new drugs used to take 10 to 15 years. AI now reduces that to months. In silico medicine, used deep learning to identify a novel fibrosis drug now in clinical trials. MIT Jameel Clinic, used AI to discover halicin, a new antibiotic that works against resistant bacteria. Gene editing, AI helps identify mutations, plan CRISPR edits, and personalize gene therapies. Fact: over 150 AI-generated drug candidates were in preclinical or trial stages as of 2025. 8. Leading companies in medical AI. Company focus area country: ADOC Radiology and Emergency Imaging Israel. Heidi Health AI Medical Scribes Australia. In Silico Medicine Drug Discovery, Longevity Research Hong Kong. DeepMind Health Predictive Analytics, Retina Scans UK. Butterfly Network AI-powered handheld ultrasound USA. 9. Ethics, privacy, and regulatory oversight. AI in healthcare raises serious concerns about data privacy, algorithmic bias, and accountability. HIPAA and GDPR compliance. AI systems must handle patient data securely. Bias and fairness. Poorly trained models may misdiagnose underrepresented groups. FDA and EMA oversight. Medical AI tools must meet rigorous regulatory standards before deployment. Best practice. AI should always be explainable, auditable, and supervised by a human clinician. 10. AI doctors of the future. What's coming next? Virtual AI general practitioners. 24/7 accessible chatbots handling 80% of primary care cases. Integration with health records, wearable data, and prescription systems. Personal health AI assistants. Like a health version of Siri or Alexa. Monitor diet, suggest lifestyle changes, and book tests or doctor visits. Full room diagnostics. Smart rooms in clinics that diagnose you via sensors, cameras, and voice. Robotic surgery as a service, RSAS. Hospitals rent AI surgical systems on demand like cloud servers. Global AI networks. AI models trained on billions of global cases for cross-border diagnostics. 11. Opportunities versus challenges. Opportunities challenges. Faster diagnosis, data privacy and ownership. Doctor time savings, regulatory uncertainty. Early detection and prevention, model bias and inequality. Continuous patient monitoring, resistance from traditional institutions. Affordable healthcare at scale, high upfront costs and training. 12. Real-world impact in 2025. Apollo Hospitals, India, report saving 2 to 3 hours daily per doctor using AI scribes and RPM tools. UK NHS launched a 10-year AI strategy with focus on surgical robotics and diagnostics. US-based startups like Nabla, DeepScribe, and Notable have collectively raised billions for AI-first clinical tools. AI investment in healthcare hit $1.7 billion by mid-2025, down from 2021's highs but now more focused and effective. White heavy checkmark. Conclusion. AI is no longer just a buzzword in medicine, it's becoming an invisible partner in diagnosis, treatment, and prevention. From automated charting to robotic arms in surgery, the AI doctor is here, not to replace humans, but to empower them. The key lies in responsible innovation, balancing progress with privacy, and technology with trust.